Vaginal rejuvenation means making vagina and vulva healthy look. Doctors like me, gynecologists, they have certain experience in how to look at the vulva and vagina and try to improve many things. One for the function, one for the look, one for inability to have any discomfort, i.e. symptom-free. For example, women who has painful intercourse, it is pain, it is uncomfortable. Women who has dry vagina, women who have also wide area need to be tightened up. Women who has a vulva require some life in it. That is one of the very important things. Also a woman who like to see herself down below, younger look. It's not only the face, also the vagina require match the face, looking younger. Sometimes for a cosmetic purpose. Sometimes the woman themselves comes forward for reasons, some painful reasons or some not good-looking reason, and that's important. This is called vaginal rejuvenation. We use lots of apparatus for that, lots of methods to improve the vagina and to rejuvenate the vagina and make it healthy looking for the lady. Vaginal rejuvenation, actually the meaning of it is trying to avoid surgery. That's the meaning of it. However, the gynecologist like myself is the one who determine and to select the cases where do they require surgery or not. Now, when we're talking about rejuvenating the area without any surgical intervention, we use modern technology at the moment. There's a lot of advance within this area and it's progressing very, very fast. For example, we have the CO2 laser, which we are very, very happy with the outcome of the results of it. We have the PRP, we use fillers, we use the G and U spots for sexual gratifications, we use other minor surgical intervention in outpatients. It's not really invasive surgery, it's a very small type of surgical intervention under local anesthetic. These are the non-invasive methods of vaginal rejuvenation. But certain cases we have to carry out surgical intervention, such as anatomically very narrow vagina and the lady cannot have any penetrations and sexual relationship. We have to carry out surgical intervention. Women with following deliveries and the area very wide to the point that she has a prolapse. Prolapse cannot be treated with a non-invasive. We have to carry out a surgical intervention. And also women with stress incontinence. This is a final piece of information. Not all of them can be treated surgically. Majority these days can be treated with non-invasive procedure, and I'm successful with a lot of these cases, but definitely certain cases we have to carry out surgical intervention. However, the end result is healthy, good looking vulva and vagina for the lady. The recovery after vaginal rejuvenation is amazing. Actually, the result is fascinating. In many cases, the patients are pain-free. They sometimes come at lunchtime out of their work, have the procedures, go back to work and carry on their work. They return back to sexual relationship very fast in certain cases. In other cases, might take a week or so, depending on the advice of me as a gynecologist. Then we come to another group of patients who have a surgical intervention. They are cases where they will have to be admitted to the hospital. They have to have a period of recovery, sometimes take weeks, sometimes take months, depend on exactly the procedure which was carried out and the reason of the procedure. Very important to know that the non-aesthetic intervention is very fast recovery. Surgical intervention, it is a slow recovery, I'm afraid.